Hello, everyone. Today we're going to talk about Phillips County, Arkansas Assessment Project, and it will be presented by Corey Hollingworth, Stephanie McCormick, Matthew Solomon, and Jaylene Valley. Philly County is a small, predominantly black rural area located in the Mississippi Delta, characterized by high poverty levels, low income, poor health outcomes, and limited health care resources. It holds the distinction of being the least healthy county in Arkansas. This county also faces multiple challenges in the healthcare. One of them being the extremely high premature death. The lowest life expectancy in 2024 shown that the year of potential life lost before the 75 per 100,000 population was 19,900. The high infant mortality is 13.4 deaths per 1,000 live births, and that's data from 2024. There is a significant burden from chronic diseases, high teen birth rate. Social determinants contributing to the health issue includes the poverty, low education, single parents household, and a rural isolation. And here we can see that the healthcare access is significantly hindered by the low providers density and the geographic distance in rural areas. With these key challenges in mind, the priority for improvements are to enhance the health outcomes. And we can start by addressing the root social drivers such as poverty, housing, and education, expand the access to primary care and behavioral health services, implement maternal and child health interventions, and focus on the target chronic diseases prevention initiative.
Phillips County, Arkansas has a population of 15,900 residents. The majority of the population is black, which makes up 52%, followed by 35% white and about 3% from other racial groups. The median household income is approximately $38,874. About 68% of residents have a high school diploma, while only 14.5% have earned a bachelor's degree or higher. Life expectancy in the county is 68 years, which is below both state and national averages. Nearly 29% of the residents live below the poverty line. And one notable trend is the birth rate, which is roughly 1.5 times higher than the national average. These demographic indicators provide important context for understanding the health and socioeconomic challenges faced by Phillips County. Phillips County consistently ranks among the bottom 10% of all Arkansas counties for both health outcomes and contributing health factors. Several social determinants play a major role in this ranking, including limited access to healthy food, high levels of childhood poverty, and a high prevalence of chronic diseases. The most common chronic conditions in this area include heart disease, diabetes, and obesity. These health challenges not only affect quality of life, but also place added strain on local health care resources. The data emphasizes the need for targeted community health initiatives and improved access to preventative care. This slide shows the census profile of Phillips County, Arkansas residents, showing the population health and well-being using the length of life and quality of life. If you'll notice that all of the metrics in the Phillips County column are higher in state and national, except for life expectancy, which is, as I stated before, lower than the state and national average.
Next, we have healthcare access. This slide depicts the proportional breakdown of the population according to the type of insurance coverage. Here you'll see the breakdown percentages of each type of insurance: Medicaid, CHIP, Medicare, non-group insurance, uninsured, military or VA coverage. As it pertains to facilities and providers, This area has only one hospital, Helena Regional Medical Center, which lacks specialty care, forcing patients to travel further for these services. Low provider availability also increases pressure on emergency departments, and behavioral health and substance use resources are limited. A new program that we suggest is enhancing community outreach for preventative care and strengthening maternal infant services by collaborating with the UAMS Centering Pregnancy Program, which will increase the frequency of mobile units in Phillips County to more than twice a month and extend mobile unit services to include infant care. It'll also promote nursing scholarships for nurse midwives to serve in Phillips County, as well as offer sex education classes in local schools, and will be able to partner with faith leaders to provide complimentary child care during prenatal visits.
We are hopeful that our new program suggestions will help address the health challenges faced in Phillips County. As mentioned before, the challenges of the elevated rates of infant mortality and teen pregnancy. This program will tackle these issues by providing prenatal and postnatal care, which is shown to significantly increase the chance of infant survival. Pre and postnatal care play a crucial role in lowering the risk of infant death and also will help prevent maternal complications. Working further upstream, this program will also help with the county's high rate of teen pregnancy, which is contributing to heightened childhood poverty and further intensifying the infant mortality crisis as babies born to teens are often low birth weight, as many teens don't get the prenatal care that they need. And research has shown that implementing comprehensive sex education and enhancing access to contraception can decrease the likelihood of a teen pregnancy by 50%. This program is also very dependent on stakeholder engagement. So we hope to organize community and school meetings to present these programs to the residents of Phillips County. We would like to invite faith leaders, school officials, community health workers, and other local leaders to join an advisory board. We would like to promote scholarships that include a service commitment pathway for nurse midwives working in Phillips County. And in addition, we would like these scholarships to go to residents of Phillips County so they can work within their community. And we would like to communicate this program effectively through flyers, radio announcements, and social media platforms through the community. On the administrative side, our plan is to have that advisory committee work with the UAMS Centering Pregnancy Program, with our local schools and faith-based organizations. We would need a program director or coordinator to oversee planning, staffing of the mobile unit, scheduling of appointments and reporting, also scheduling of the staff. The mobile unit staff would be comprised of nurse practitioners, certified nurse midwives, registered nurses, and medical assistants. We would also like to utilize community health workers to help with scheduling and post-op appointments. And then our volunteers and partners in the community to help with free childcare and for our school educators to assist with sex education delivery. Some of the logistics to implement this program would include having our equipping our mobile health units with essential prenatal and infant care tools, including ultrasound machines and basic clinical laboratory equipment. We would like to utilize our campus, our UAMS campus in Helena, and also we would need collaboration with schools and churches for education and childhood services. hopefully utilizing school after school programs and churches for free childcare during these prenatal and postnatal visits.
Appointments for
and then we have to address the technology issues.
And then as far as technology
we would have to make sure
access
that
to electronic health
our patients have
through
access to their
secure,
electronic
mobile
health
Wi-Fi
records,
is
and
essential.
that there is
So
a
we
good
would,
Wi-Fi
we would need to make
available
sure
in the
that
area.
we have
And we would
good
want
access
telehealth
to,
features for
Wi-Fi
remote
in
consultations
that
and a
area.
scheduling
And then also
system designed
offer
for
telehealth
mobile unit
features for
visits.
remote
So as you can see, there
consultations to
are
our
a lot
patients,
of working parts
and
and
a scheduling
pieces
system
to implement
designed for
this new
mobile
program.
unit visits,
But
which
I believe with
hopefully
the
our
help
community health
of the
workers
community,
would be able to assist us with as well.
we
So as you
can
can
implement
see, this program,
a successful program
implementing
in
this
Phillips
program
County.
has a lot of working parts and pieces and would utilize a lot of community members and resources. But if everyone could work together, I think that this is something that could benefit Phillips County.